CJ Stroud exits today's game after taking a hit where his head hits the ground hard. Welcome back, my name is Dr. Stefan Wilson, and this channel is designed for the better understanding of sports injuries. So when we look at the replay here of what happened, Stroud, he drops back in the pocket and he completes a pass over the middle. After releases the ball, this is where the contact occurs. This angle doesn't really show it a whole lot, but when we watch it from the one here, we can see how the Jets defender makes contact with Stroud on his left side and then takes him to the ground. Stroud then lands on his back, and when the back of his helmet, it really hits the turf hard here. Even with the protection of his helmet, this is still a lot of force that is going to be translated through his neck and his head. There is definitely a whiplash component to this play, and that will cause Stroud to have a lot of neck pain. But the more concerning outcome here is when his head slams off of the turf. When we stop the replay here, we can see the look of discomfort on Stroud's face. He knows something is wrong. Both of his hands come up towards his head as this is just a natural reflexive reaction to when a painful stimulus occurs. Typically, we do reach for the area that has just been injured, and that's exactly what Stroud is doing here. A hard hit like this certainly looks like enough of a force to cause a concussion. When a concussion occurs, it can happen from any different angle that affects your head and your neck. Essentially, the mechanism involves the abrupt deceleration of your head, which is what we see when Stroud's helmet makes contact with the turf. This then causes the inertia of the movement of your brain inside your skull to collide with the inside of your skull. In Stroud's case, that will be the back of his skull in what we call the occipital lobe area of your brain. It is this abrupt collision that shocks the soft tissue of your brain and initiates the beginning of a concussion. That shock of the impact for your brain will cause the electrical circuits of your brain to malfunction in a chemical reaction. From this, that's what begins the cascade of events. Here, I want to point out the difference between two things here. What we observe and look for in a person with a concussion. The first thing is symptoms. Symptoms of a concussion are things that the patient can actively report to you. The patient needs to have the ability to communicate here, and a few examples of this can be having a headache, feeling nauseated, confusion, or memory problems, or feeling dizzy. These are reported symptoms from the injured person. These symptoms will absolutely fluctuate, though, in the time following the impact. So it is not uncommon to have a sort of delayed reporting of symptoms after an incident like this. We can compare that to what we call signs of a concussion. A sign is something that a responder can visually observe and appreciate in the injured person as opposed to the person self-reporting it. A few examples of this are loss of consciousness, lack of awareness, change in behavior, the inability to recall dates, names, or events prior to or even after the incident. Team officials for the Texans will be aware of all these issues and will, of course, use every means of their disposal in order to thoroughly evaluate CJ Stroud. Stroud will now enter into the NFL concussion protocol, and hopefully he does recover soon. Thanks for watching. Take care.